5 on your health tonight, and we're talking the mass firing of vaccine experts at the CDC. U.S. Health Secretary Robert F. Kennedy Jr. now pledging to choose replacements who will, quote, restore trust in vaccine science. Joining us now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Always good to see you.
Good to see you, Jessica.
Let's talk about this because we know now at this point 17 people on the CDC's Advisory Committee on Immunization Practices, all 17 of them now gone. What's been the reaction from you, your colleagues?
Right. So remember, this advisory committee tells us how we should deploy vaccines, who we should give it to. Right. The FDA says who we can give vaccines to. The ACIP, the CDC says who we should give it to. And the bottom line is the Infectious Disease Society of America, the American Academy of Pediatrics, they're very disappointed. They're troubled by this unilateral dismissal of essentially the entire ACIP. In fact, the American Medical Association said that this committee has been trusted, with vaccine decision making for generations. And so, it's definitely a big change.
So the question is now, because we know that Secretary Kennedy, the U.S. Health Secretary, says some replacement candidates are already under consideration. Typically the process can take months, maybe happening a lot quicker. What is the process like? Well,
look, there's typically an ACIP, this committee has a steering committee, and they'll vet candidates, experts in the field, of course, of vaccines. It has to be a wide range, diverse. You need people who are experts in pediatric vaccines and adult vaccines and elderly, people who know how to read studies and interpret epidemiologists and the like. And I think that the issue is that we have to make sure that this is important for knowing how we deploy vaccines. Mm-hmm. So I think that they're supposed to meet towards the end of January. We'll see if that happens. Does that happen? What will the replacements look like? Ultimately, though, the Secretary of Health and Human Services has the final decision on who gets into this committee, who's appointed.
So we're going to have to wait and see who that is.
We're going to have to wait and see.
What challenges do you anticipate or deadlines do you think that they'll be facing this new committee?
Yes, there are so many challenges. Remember, we're in one of the biggest measles outbreaks right now that we have seen in decades in the United States. Influenza last year was the worst it's been in about 15 years. And we have a declining rate of immunizations in not only adults and children. There's a lot of mistrust. And I think that's one of the central themes here. How can we get that trust back? We need to make sure that this committee, is appointed with experts that, remember, they should be independent of the government and industry. They're typically vetted for conflict of interest. That's really important. And these meetings are when there's important decisions being made by this committee, it's always done with the public being able to access these meetings. So transparency is key.
All right, Dr. Ellerin, we always appreciate your insight. I'm sure we'll be talking about this more as more information comes in about this as well. So always appreciate your time.